The first time I heard that I had cancer, well, I think at first I didn't believe it. You know, I thought, no, everybody else gets cancer, not me.
The 21st century will see revolutionary advances in cancer diagnosis, treatment, and prevention. The Sidney Kimmel Cancer Center creates a bridge between laboratory discoveries and clinical treatments. As an affiliate of Sharp Healthcare, Sidney Kimmel's Clinical Oncology Research Program is providing new treatments, preventative measures, and diagnostic techniques to cancer patients throughout the San Diego area.
And the problem is today we inject very toxic compounds into patients, chemotherapeutic agents, and they work on killing all kinds of cells, including tumor cells. And the reason they work on tumor cells is because tumor cells divide a lot. They divide very quickly. Well, guess what? There are other parts of your body, other cell types that also divide quickly. And so you'll have a situation where you're killing the tumor, but you're having a bad effect on other parts of the body. And it's sort of a game of killing the tumor faster than you kill the patient.
Chemotherapy is very barbaric. I mean, if you think about it, yeah, it works, but it also, not only does it destroy your cancer cells, but it destroys your good cells. And it kills some people. At the Sidney Kimmel Cancer Center, the treatment that I was given attacked the cancer cells and did not attack other cells. And it also boosts my immune system.
Why are non-traditional treatments better? Because they're at least experimental and they're trying to do things in a different way, given that the old way isn't a good way. We're all trying to identify what we can target in a tumor that's specific to that tumor, so that you can deliver drugs only to the tumor, have the effect you wish in a tumor, which is usually to kill the tumor cells, and not have a bad effect everywhere else.
It was amazing because the doctor had told me that after about a couple treatments, I would no longer feel the lumps that I had, and it was true.
One person working in one lab at one university or one physician in a single clinic can make a change that will affect the lives of millions of people all over the world. So that's a wonderful opportunity. And of course, here in San Diego, we have one of the largest collections of health science companies, cancer research institutes, and scientists in the world.
It's a fairly small center, so each individual is correspondingly more important. We're all big fish in a small pond, and if you like that kind of thing, it's an attractive place to work. But the other thing is it also gives us the ability to basically concentrate on the strengths of the individuals that we have here. You don't get completely overwhelmed by all the possibilities, and so we can actually play to the individual strengths. And I'd say that the Sidney Kimmel Cancer Center is per capita, per person, by far the most successful organization in the country.
I always felt like I was so lucky to have found Sidney Kimmel and to be, you know, although I was in a clinical study, I just felt I had nothing to lose. You know, I had all these scientists and doctors and pharmaceutical companies behind me, and other people were just getting like the traditional chemotherapy and other things that were on the market that were pretty invasive to their bodies. And I just felt really, really lucky.
To do science, it takes money. If you don't have the money, you can't do the science. If you can't do the science, you can't discover cures for cancer or other systemic diseases. So not having the funds is very frustrating, and it limits the work that we can do.
Progress in cancer therapy is progressing nicely, but we need more assistance to be able to do this. A lot of times it's very difficult today with all the new techniques that are being developed in order to analyze new targets, find and discover new targets, but it's very competitive out there. It's going to require the kind of funding that needs to increase year after year so we can do more work in that regard.
Every dollar that's spent for cancer research has a potential dramatic impact on new directions in therapy.
The other thing that I love doing is spending time with my grandchildren. And one of my girls, one of my granddaughters that is 7 years old, I pick her up every Thursday from school, and you know, I do different things with her, and she enjoys just hanging out with me. I'm really grateful. I mean, I really think I owe my life to Sidney Kimmel.